So I'm Dana Wong and I'm an Associate Professor and Clinical Neuropsychologist in the School of Psychology and Public Health. So this award is about how we train clinical neuropsychologists, and we're psychologists who specialise in understanding and treating people who have conditions affecting the brain. So traditionally the role of a clinical neuropsychologist has been around assessing and understanding these brain conditions. What's received less emphasis is how we support and intervene to treat people who have these brain conditions. People who have brain conditions report a lot of unmet needs in terms of their changes in cognition, so thinking skills, and also their emotional adjustment and behaviour. What I've been trying to do is to train our clinical neuropsychologists to be confident and competent in supporting and treating people who have brain conditions so that they can fill that gap in our service provision and provide these services for people who need them. It's really satisfying to have students come away from a course and feel, I guess, inspired to help people and to help make lives better. It's really meaningful and satisfying to know that there are more people who are benefiting and that these kind of interventions are more accessible. The process of applying for the award was quite interesting. It provoked me to reflect on what teaching methods I was really using and why I was using those and what effect they were having on students. I ended up having a more coherent narrative, I suppose, about my teaching approach than I had to start with. Working with the education team here was really great. They were really supportive and very knowledgeable about education approaches. Psychology training generally is in a bit of a crisis, and we need more psychologists. We need more general psychologists, but we also need more psychologists who have these specialist skills like neuropsychology. The funding for these programs from the government at the moment is not adequate. This is a situation that needs to change, and I hope that throwing a light on what work we can do when we're given the opportunity to teach these programs will help bolster our argument for these programs to return and for them to be funded better at the government level.